I think the specific value of CNS penetration is certainly to treat those patients that already have brain metastases. They really do not have great treatment options. We often use neratinib or lapatinib in these settings, but even the benefit there is short-lived. These patients ultimately progressed. It can be hard to tolerate those drugs, but I think the other benefit really is the fact that we know that 50% of patients will develop brain metastases. So I think this is a very exciting regimen for even those patients that don't have brain metastases, because the reason people develop them is that the brain is a sanctuary. Our other agents don't get there. And so if we use something like this earlier on, it really could conceivably prevent brain metastases. And we always love prevention instead of just treating something once it happens. So the side effects of HER2CLIMB predominantly came from the other agents that we know of. Capecitabine causes hand-foot syndrome. It can also cause a little bit of nausea. It's a chemotherapy pill, a little bit of diarrhea. It goes through the GI tract, etc. And palmar-plantar erythrodysesthesia, or redness and peeling on the palms of the hands and the soles of the feet. It didn't really appear that tucatinib worsened these symptoms. Trastuzumab we're all quite familiar with. It's an IV infusion. It's an antibody against HER2. The main thing we have to watch out for with trastuzumab is decreases in ejection fraction, or how well the heart squeezes. Again, tucatinib did not worsen this. The side effects specific to tucatinib, it had a little bit of overlap with liver function test increasing. These were all reversible, but that in combination with the capecitabine, we did see some patients that had to hold or dose reduce for liver function test abnormalities. So HER2CLIMB met all of its endpoints. It met for progression-free survival of an improvement of a little over 2 months. It met for overall survival in the all-comer population with an improvement of overall survival of 4.5 months. And it met its endpoint for progression-free survival in those patients with brain metastases. So across the board, it was positive. So I do think that the HER2CLIMB results are practice-changing. I think that we will see an approval of this agent shortly based on these results. I think this is practice-changing not only for our patient population that has brain metastases, but also for those patients post-T-DM1 in chemotherapy, trastuzumab, pertuzumab that don't. Hopefully is more of a prevention strategy for future brain metastases. It's a highly active combination. It's easy to give in the clinic, and patients generally feel well on it.